Thank you very much, Lola. Greetings to all who are following us on Facebook and other platforms. Hashtag Social Work Response, IFSW Response. Thank you very much for joining us for this webinar. This week, we have an exciting lineup of a panel that will discuss. Joachim, who do we have this week?
So this week, we are privileged to have Olu from Nigeria. We have Kennedy from Zambia. We have Dalia from Egypt. We have Pauline from Namibia. We have Charles from Uganda. And then we have Nigel from the UK. So we have an exciting panel and with a lot of insights to share with us all. No?
What are we discussing this week?
This week, basically, we're looking at the ethical dilemmas in response to COVID-19, as well as the human rights concerns. So there are a lot of issues, I think, that is there for us to share and to learn from those of us that are working in responding to COVID-19. And we'll be learning from different countries, from the countries that we've listed earlier.
Thank you very much, Joachim. Before we start, we would like to acknowledge IFSW Global. We also want to acknowledge Children and Families International Foundation. And we also want to acknowledge Lola and Anton, who are in the background providing us with technical support. We also encourage participants and all those who are following to raise questions, and they can share these on Facebook or the WhatsApp platforms. They can also send onto the IFSW platforms. Without wasting time, who starts today, Joe?
Also today, we are privileged to have Olu Jacob. He's the representative for the Africa region, IFSW, on the Ethics Commission. So he's gonna start the ball rolling. So over to you, Jacob.
Good evening, all.
Good evening.
My name is Olu Jacob. I am the former Deputy President of Nigeria Association of Social Workers. I'm presently the IFSW African Region Commissioner to Ethics Commission. I presently working with the Child Development Department, Federal Ministry of Women Affairs. I've been in practice for the past 32 years. I have experience with Social Welfare Department, Rehabilitation Department, and also the Community Development. So I've also gathered experience while serving with the Nigerian Association of Social Workers, and my present assignment with the Ethics Commission. So thank you very much.
You may proceed to talk and give us your presentation regards COVID-19 and also issues to do with ethics within the Nigerian space.
Yeah, thank you very much, Noe. Before my presentation, apart from my own practical experience, I also contacted social workers who are in different settings, who are currently engaged, who are currently on the field, and also gather information on what they are doing. So I need to report that also. That will be part of my presentation. I want to start by saying that COVID-19 is a global health crisis that is spreading across the world. Its upsurge in China in 2019 and its impact on the world economy calls for continuous proactive measure. But what is unknown and yet to be unraveled is the root cause of this pandemic and the level of its spread. Disease has killed thousands of people globally. COVID-19 is a threat to every persons and communities, considering the rate at which the virus spread in recently in Kano State. That is not Western Nigeria, not Western Nigeria. The disease started noticing in Lagos, and it was widespread And in Kano State, we are having 2 or 3 persons, but recently, from last week, the rate is alarming. And with the spreads, which has surpassed that of Lagos State, where the virus was detected is not controlled, Nigeria is likely to be on fire. All at risk. People that we most often work with at office, especially social workers, currently with the vulnerable, are potentially at particular risk. For instance, some social development assistants and other professionals are under greater stress because they have less access to protective factors such as healthcare, good nutrition, good housing, education, safe home, and social networks. Stresses are increasing for many as a result of job loss, stay-at-home requirements, school closure, among others. Ethical dilemma are problems with no clear standard or rules determining process for a specific situation. Social workers must manage values, moral, and behavior within the context of legal and regulatory obligations. We stand with the vulnerable group and disadvantaged to advocate, promote, and protect the human rights violation, which include poverty, hunger, and homeless. The ethical guidance for social workers aims to respond to the very specific circumstances generated by COVID-19, which disrupts health, safeguarding, and support services. Practitioners working in emergency situations may face choices and decisions that go far beyond the bounds of ethics and practices, including rationing of support and resources and more stringent prioritization. It is important to note that an ethical response by social workers to dealing with COVID-19 is not only about the decisions or action taken by individual social workers, employers, other professionals, and the requirements. Social workers or social development practitioners working in some social work setting in Nigeria are facing different challenges during this pandemic. This includes personal health concerns, caring responsibility, financial worries, and many other issues that impact on our capability to offer support to others. It is essential for the practitioner to be aware of their own care, needs, and worries, seek help, and to look after themselves, and each other in difficult times. Kindness to self and others will be crucial for well-being and morale. Social workers are part of the communities, and their ethical responsibility do not end when they leave the workplace, but extend to every aspect of their lives. Ethical consideration should be paramount in all our dealings. I want to give some practical experiences, my own practical experiences, and also others that are also currently in the field in Nigeria. We have been on lockdown, and during the lockdown, my office and some offices are also discharging palliative food items to vulnerable Nigeria. And also, we are also doing skeletal work. You might be called to the office whenever there's any emergency. So I was called without prior notice to join others in the distribution of food items, advocacy, and also drugs to IDP's camp. That is internally displaced persons camp. We are accompanied by 2 officers of the Civil Defense Corps serving the ministry, but the police area commands were not officially notified. We were only given an introductory letter, the security introductory letter from the ministry. I observed that police were not informed. So I told my boss that we might have security issues during this assignment, but she said there won't be any problem. We worked till 11:30 p.m. distributing the items when police patrol teams stormed our last locations, asking for police permit. We were interrogated and detained, but it was our ID cards, identity cards, and the pass letter with some cause that eventually save us. We did not observe risk assessment. In this situation, we are supposed to apply the risks involved in this assignment. but we did not do that. And also, I was faced with a dilemma in the sense that I quietly understood what would happen, but I couldn't reject the assignment because the assignment came from a superior authority. So we have to embark on the journey, but which eventually the security lapses was observed, was taken into consideration. The lesson 2, the lesson I can take from that is that social workers should always practice safety precaution in their work. Safety assessment and risk reduction with all clients and in all settings should be practiced always. Case number 2, children in emergency. In the case of child sexual abuse during the lockdown, I got information that the unwillingness of the parents to stand to prosecute the abuser is very challenging. So social workers have ethical obligation to report the case. To report or not to report becomes ethical dilemma since the parents were not willing. Case number 3, humanitarian setting. In humanitarian settings, there have been reports of adolescent girls and vulnerable ones willing to exchange sex for relief materials. Social workers have an obligation to protect the dignity and worth of the children, but lockdown is affecting the process. Case number 4, cultural belief. The culture, in some cases, promotes abuse. For instance, child marriage. While the social worker has the ethical obligation to protect the child, it is often hard to deal with it. And case number 5, correctional institutions, prison service. Some of our colleagues are currently working in the correctional institutions, and due to poor government policy, lack of incentives, inadequate, sophisticated, or latest tools to work, and shortage of prison social workers, or lack of recognition of the roles of social workers, the few social workers working in the correctional centers were afraid of risk of facing both visitors and inmates without adequate supply of gadgets, because they believe that the social work activities is not the most priority within the agencies, just like the prison officers. So, and since we don't have a regulatory body, so they tend to use the initiative to discharge their duties. And this is the dilemma they are facing. And case number 6, policy areas. I also work with policy formulation, and when we observe that social work has not been given the rights of place in the country. For instance, social workers are not included on the presidential task force on COVID-19. Although social workers are playing their roles in various settings, this holistic intervention approach by governments is not being observed, because if all professionals are not carried along, like the area of psychosocial support, that is where social workers should come in. We have victims who are in isolation centers, and their families are worried. As a social worker, we need to connect with the families in terms of giving them psychosocial support and also boost my morale. But officially, this cannot be done. I'm in touch with the Ministry of Humanitarian Affairs and Disaster Management, while I also work with the Federal Ministry. It's only a few staff of Social Welfare Department and Rehabilitation Department that are involved in the activity that is going on. When we call them, they will tell us that there's nothing they can do, so because we don't have any regulation to back our activities. So I want to say that social workers who are in the field are performing their role effectively, but especially those in the hospitals. Those in the hospitals, they are performing their roles. They have personal contact with the victims. That is, they are working in the isolation centers. And we believe that with the activities of the medical social workers of Nigeria and Nigerian Association of Social Workers, based on the directive that was issued a month ago, most of them are involved in voluntary services. Most social workers in Nigeria, they are on social media. They have platforms which they are using to connect with the vulnerables. And the ethical issues is most paramount because they are performing their roles, believing that what they are rendering is a voluntary service or their service to humanity. But most time they have issues with the how ethics can be connected to what they are doing. And due to the non-regulatory body, and also most people who are discharging the activities during this COVID-19 situation, most of them are social development assistants, those that were employed without the prerequisite qualification. And most of them don't know what the ethics of profession is all about.
Thank you very much, Ulu, for sharing those thoughts. We will come back to you later when we get the chance to do so. Let us move to another. And thank you very much for sharing that. Joachim, who do we have next?
No, thank you so much. And thank you so much, Olu, for your thoughts and your experiences. And today, Africa, as we do our conversation, we want to explore more on some of the common situations faced by social workers in practice in terms of ethical issues. So Noel, we'll be moving now to Kennedy Mumba from Zambia. So we'll ask him to basically introduce himself and say a little bit about himself, and continues to make his presentation.
Thank you.
Thank you very much, and greetings to everyone. Yes, I'm Kennedy Mumba. I'm currently working in the Ministry of Community Development and Social Services with an unbroken record of 25 years of service. I'm currently working as a director for the Department of Social Welfare. I also work as a principal probation officer, as well as commissioner for juvenile welfare. So I've got 3 titles. And in Zambia, this is the ministry that is discharged with the affairs of looking after the poor and the vulnerable and providing a myriad of social services, not only for poor people, but even the rich in terms of adoptions and other social challenges or social problems. So indeed, this is a very, very interesting topic that we're discussing today, where we are looking at the space of social work practice, particularly in the wake of this COVID-19, where our ethical principles, values, and the need for human rights comes to the fore. Ours is a noble profession. It's a noble profession because we are closer to humanity, and we need to be there when the need really, when it really matters. In this particular era, we are at a stage where almost everyone is in a sense of despair, increasing vulnerability, not knowing what is happening, what to do. And this poses a very great challenge to us social workers on how to make sure that our society continues to exist, relations continue to be maintained, and that each and every person is still considered to be trustworthy and being given the necessary dignity which they require. This is the stage where really service provision becomes very key and very critical. And a profession like ours, social work, we are now the frontliners, and we are the ones to guide how best to deal with these things. However, There are a number of dilemma issues that in my context, like in my country, I've observed. Zambia started experiencing COVID-19 cases somewhere in February, March, where currently we have about 139 cases, in which we have recorded 4 deaths.
It seems we're losing Kennedy. Noel. Okay, so we've lost Kennedy, and I think we may just need to continue. So I think we'll move to Dahlia, and then when Kennedy's connection is restored, we may need to get back to him. So we'll move to Dahlia, Dahlia from Egypt. And Dahlia, please, you only have 7 minutes within which you need to introduce yourself and share with us your experiences on the ground in Egypt.
Okay, welcome to members and welcome to all viewers. My name is Dalia Kamel from Egypt and I'm working as a manager of God Family Office and a master researcher in Faculty of Social Work, Department of Social Work, Covetous, Helwan University. Secondly, I believe that social work humanizes profession and its higher roles to face coronavirus crisis. In addition, learning and helping people how to face this virus and keeping safe. The rules is application of the 3 basic goals, including in number 1, developmental goals through development people awareness. Hello? Sorry.
Yes, we can hear you, Dahlia. Please go ahead.
About coronavirus and its negative effects and community in situations that can provide the helping to face coronavirus. Number 2, preventive goals through using the preventive intervention with 3 levels to prevent the people from coronavirus and its negative effects. Number 3, treatment goals to decrease and treat the bad effects of coronavirus, such as social effects, psychological effects, economic effects. To applying and achievement these goals, the social worker must use social work ethics, methods, and intervention. That's including number 1, clinical intervention, spiritual intervention, preventive interventions, and social support and empowerment, group therapy method, community organization method, and the principle and values of social work, electronic social work, and manage the crisis intervention. We can applying these interventions and methods in 4 categories. Number 1, non-infections people. Number 2, infections people. Number 3, the family of infections people. Number 4, the medical team work of infections people. We will linking between the 3 basic goals and the ways to applying for this 4 system. The social worker rules it. Number 1, make an awareness seminar in various social media about coronavirus and how preventive ourselves from it, and the community organizations can applying the support to face coronavirus, such as medical, social, and psychological organizations. Number two, make a posters and brochures about coronavirus syndrome and the bad social and psychological and economic effects. Number three, contact with all community organizations that can helping the people and support them, and make a several meeting about how we can face the coronavirus. Number four, contacting with the leaders of the popular and local community to sharing in the economic supporting and moral service as clothes, food to the family and community damaged by coronavirus. Number five, use a spiritual therapy to support the patient with coronavirus and their family and the people that suffer a panic from an infection coronavirus, and motivated them to for the need for spiritual contact. Number six, use the clinical intervention processes to find out the social and psychological effect of coronavirus on individuals, families, groups, and small communities. Number seven, use the power grant model to help people to recover their balance to face the coronavirus. Number eight, use a group therapy as a way to decrease the bad feelings for patients by use group video that each patient can sharing his feelings and his hobbies as singing and drawings, and notice that make them is better psychological condition and help them recover. Number nine, use the family therapy model to solving the bad effects of coronavirus that can damage the balance of family system because the head of the family is out of work or infection, he's in coronavirus. Number 10, design a social programs and activities that helping people to stay in homes and development their awareness of how dealing with children and strengthening family relationships and how benefits from the time in home. 11, contact with educational organization about make free online training courses as a way to use time. 12, applying support the social and psychological to the medical team in hospital to decrease the bad effects who are exposed it. 13, crying for the homeless category and children without protection and protecting them as they are among the most able groups to be infected with the coronavirus. 14, perform psychological and social tests to measure disorders caused by the coronavirus. 50, and create websites for providing appropriate psychological and social support to all the coronavirus infection and damage. Thanks for all member and all viewer.
Thank you very much, Dalia. Maybe we'll come back to you later with a question in terms of human rights issues that you see around COVID-19 responses that you are having in Egypt. We'll come back to you later when we have another cycle of questions. Thank you very much for your presentation. Thank you.
Thank you very much.
We will move now on to Pauline, who is in Namibia. Thank you very much. We will move now on to Pauline, who is in to share with us what is happening in Namibia and ethical issues and human issues around COVID-19 in Pauline, are you with us?
Yes, I'm with you. Good afternoon to everyone and to the viewers out there.
Are you with us?
Yes, I'm with you.
Thank you very much. You can go ahead.
Okay, thank you very much for the opportunity, and good afternoon to all the viewers and to everybody online right now. My name is Pauline Jaimene. I'm a social worker in Namibia with over 12 years experience in child protection. I'm currently working as a social worker for SOS Namibia. I'm based in Tsumeb. And I would like to start off my discussion today with a quick overview of what Namibia has done so far since the pandemic has spread to our country. So I would just like to give a brief overview on that before I delve into the issues of the ethical dilemmas that we are facing as social workers now, that I have seen personally that has occurred since the pandemic has been identified in Namibia. My presentation reads as follows. The COVID-19 pandemic spread to Namibia with the first confirmed cases announced on the 14th of March 2020 by the Namibian Minister of Health and Social Services. The country went into lockdown on the 28th of March, and to date, 16 cases were confirmed, and with 8 who have recovered since then. And no new cases were reported after the 5th of April, and the virus caused no casualties in the country. These statistics may sound to be very low. However, compared to the population in Namibia, it is quite an alarming state, because if we allow the situation to continue, or if the lockdown procedures were not enforced in Namibia, we could have a catastrophe on our hands. However, I would like to continue by saying that our country is known for the income disparities that we have, and we are one of the highest societal inequalities, society with inequalities in the world. However, despite this, the government has managed to pull resources together to minimize the impact that the lockdown regulations had on has on the population. Now let's look at some of the government responses so far. On the 17th of March, our president declared a state of emergency as a legal basis to restrict fundamental rights. For example, to freely move and assemble as guaranteed by the Constitution. And already there, I identified a ethical dilemma, because one of the values that we have as social workers is the importance of human relationships. And by virtue of that regulation, the government has restricted movement of people. And therefore, as social workers, we are unable to reach the communities out there who may need our help. And also as a precaution, or rather as an ethical dilemma for a social worker, you would love to help your communities out there, but you're also having to think about yourself and put yourself first in that situation, but then also think about your ethics and the values that you ascribe to as a social worker. So there already I identified a conflict. And to move on with my presentation, the government has adopted the WHO 8 pillars for the management of the response, and that is number 1, the coordination, management and logistics, case management, infection prevention and control, surveillance, laboratory points of entry, risk communication and community engagement, mental health and psychosocial support, under which we social workers fall. And as a precautionary measure, the head of state also implemented the phased-in approach to the lockdown procedures soon after the first 2 confirmed cases. So therefore, we in Namibia are now going through stage 1 of the lockdown, and the regulations have somehow been relaxed so far. However, the good thing that came out of this lockdown, I must say from my side, is that Alcohol, the sale of alcohol has been banned in Namibia, and or rather that it's forbidden, and it has contributed immensely to the reduction of road accidents, as well as the GBV and violence against children. We anticipated that that rate would actually go up. However, the situation has proved to be otherwise, and that is something that I think as a country we need to be commended on. And the other issue that that the government has put in place is that the water supply of households that were cut due to non-payment were ordered to be reconnected. And we are referring here to the most vulnerable of our society in the country whose water were cut off. Regional and town councils were supplying water tanks to the most vulnerable, especially in informal settlements. As you know, one of the I don't want to say rules, maybe then call it that for lack of a better word, is that you need to wash your hands with running water and soap. And our communities out there were struggling with the regular supply of water. So that is a heads up to our government for supplying those water tanks to our community. Another issue that the government has done well was the emergence of the emergency grant that was set up to distribute 750 to every person that has lost an income or faced difficult conditions due to the lockdown. As we know, most of our communities, like I've also alluded to earlier, most of our communities are low, live in poverty, and therefore this grant really came in to help them a lot with buying the necessary foodstuff that they needed as a family. And myself, I have heard stories of how the 750 Namibian dollars alleviated their plight, and then at household level to ensure that food security was ensured at household level. So therefore, and as we know, rather, as social workers, poverty, hunger, and homelessness are violations of human rights. And social workers, we really stood with a disadvantage on this part, and we are part and parcel of these regional response committees in campaigning for social justice, which included making sure that communities get equal opportunities to the community support that was available in all cities and towns. So social workers didn't just sit back, and we actually advocated for us to be recognized as essential service providers, and therefore we were not under lockdown as expected initially. We had to go out there and be there for communities. However, also having to take precaution over our own safety. With regards to another social challenge that we faced, that I saw personally, was the dignity and worth of people. Now we know that as social workers, we respect the inherent dignity and worth of people, and we treat each person with a caring and a respectful fashion, mindful of individual differences and cultural and ethnic diversity. And you would notice that with the distribution of food and water to the communities, that the distributors would favor some community members over others. However, as a social worker, you would come in there and promote equality for everyone to receive the little that was out there to be offered, so that everyone can get a little bit of something, and therefore ensure that our communities do not go hungry in this time of lockdown. Because one of the other things that we need to take into account is that our economy, especially for the local traders, they suffered a lot because it was closed down. They could not trade. Therefore, there was no income for such low-income family. And really what the government has done for Namibia can be commended. And I will also applaud the social workers who are playing the different roles throughout the country, wherever they are, and especially the ones who are working in the women and child protection sectors. They have been working on a 24-hour basis to ensure that if a client calls, there is somebody on the other end of the line to pick up and assist that client. And particularly where I am based currently, I am working in a children's home. And one of the lockdown measures that we are applying here is that the children's movement was limited. As much as we have a long time period where children are staying at home, they are not allowed to go outside. Therefore, they are just within the premises of the organization. And we have received enough foodstuff to cover us for the next 2 months. And the children have been kept busy with various activities ranging from netball, soccer, volleyball, creative tasks, and all that. So we ensured that we kept our end of the bargain. And I should say that I am privileged to be here because I'm part of the community. I'm within this community. I've been with them before the lockdown, and I've went through this whole way with our children. Therefore, for us, it was really not, we were not so much required to keep the social distancing between us because we are one family. And I really love that we have this family set up within our sector here, because it encourages us to work together and go ahead. I think that was all for me. Thank you so much.
Thank you very much, Pauline. That's a lot that you're doing in Namibia. It is very interesting, Joachim. If we can reflect on the presentation we've had so far. Interesting, Pauline, in your discussion, she raised issues food distribution and how some people are disadvantaged in accessing this food. All important is the issue to do with gender-based violence as a result of the lockdown, and also that COVID-19 itself has brought about restrictions in people's movements. And on top of those restrictions, then some of the issue coming out like gender-based violence. You also raised another important, interesting issue that is also very topical within South Africa, who is your neighbor, in terms of things like tobacco sale, which others are even challenging as a human right violation, that they are being denied their rights, and that the declarations themselves are coming at a cost of minimizing people's rights. That was very interesting. So what is your take from the presentation so far?
No, very insightful indeed. When you're also looking at the state of emergency, where people's rights to movements have been limited, and then we are talking about social workers not being able to reach out to their clients, and at the same time, even the clients are not being able to reach out to social workers for services. So that obviously becomes an ethical dilemma. I was also trying to reflect on the messages and the messaging that we are giving out to the communities, encouraging the communities to wash their hands with clean water and soap. But then the ethical issue comes in. What if the communities don't have access to clean water? What if the communities don't have access to soap? So those are some of the key issues actually that we need to look at. And I'm happy that as social workers, we are not talking about social distancing. We are talking about physical distancing, because social distancing may mean that we may not really be concerned about what is happening, to our neighbor next door. But I think the focus should be on physical distancing, which I think is key. So even the messaging that probably are coming to social workers, as they are reaching out to communities, also create some ethical dilemmas, because as social workers may need to synthesize some of the messaging that we are supposed to give out to the communities. So that was a very good presentation. We've learned a lot also from Namibia, and we're really looking forward to learning so much from other countries. Noah?
Her presentation, she talked about the government providing, that is social grants to the disadvantaged and vulnerable, and she spoke about 750 Namibian dollars. At today's rate, you're looking at about 18 United States dollars. Maybe we didn't go further to ask her how much and how much that would take a family and people through in terms of the assistance. But she did chronicle that the government is doing something in providing water and other things. But interestingly, you raise a point where you talk about the guidelines in terms of the guidelines that are being given, things like washing of hands and access to clean water and such things. It is interesting that when these guidelines were given, these things were not discussed in terms of, do people have access to these things? So COVID-19 also brought about other human rights, like education, like other things that were not there. It sort of exposed societies and governments for not providing more to their citizens.
That's right, Noel. And maybe just to indicate to our panelists, the speakers here, that we have a large following. People are following us on Facebook, and they are listening in. We have different people from different countries: Australia, Indonesia. We have some from the United Arab Emirates, Malawi, Canada. So all over the world, so the world is learning, and they're having a conversation with Africa. So let's continue. Noah, are we moving to the next speaker, or do we get back to Kennedy Mumba, who we got?
Let's move on to the next speakers. Then we'll have to invite Kennedy back. Would like also to apologize to those following that we had a technical problem and lost Kennedy. We will continue to try and link up with him to get his presentation. I think with that, we would want to move to Charles in Uganda.
Okay, Tawara. Hello.
Hello, Charles.
Yes, good evening, and very happy to be joining this. I am having an ethical dilemma, just as a disclaimer, because I've got to leave where I am soon, so that I am within the curfew period. So this is the operating environment in which I am. But nevertheless, I'll try my best in 7 minutes to try to present what I wanted to present. For those with whom I'm interfacing for the first time, my name is Charles Chabo. I've been the immediate past president for the National Association of Social Workers in Uganda, and I'm the commissioner for human rights in the National Federation for Social Workers in Africa. I work for UNESCO. When I looked at this topic, it was a bit challenging for me, but I thought I should put it in context. We are looking at ethical dilemmas and human rights concerns in the period of COVID-19. To put it in perspective, I wanted us to understand how this COVID evolved and where we are and how we are responding. Many of you, and we all know, towards the end of December 2019, when we started hearing there's a strange sickness in China, all the efforts and the attention was going to China. But at that time, it was looked at as just a minor flu, which would be cured shortly. But it kept on moving and increasing to an extent that sometime in January, towards the end of January, World Health Organization had to declare it as a pandemic. And because it was declared as a pandemic, countries had to respond. And they responded almost in the same way, because there was no experience in the past of how to respond to this pandemic. So most of the countries that responded by lockdown, social distance, closing public places, because that was what was tried somewhere else, and that was the only practice that was there. So because of that kind of lack of precedence, and because of lack of experience, The response, therefore, resulted into ethical issues for social workers. In many cases, many people found themselves in crossroads. I will cite some few examples in Uganda just to drive my point. To begin with, let's look at it this way. When governments and people responded to the crisis of COVID-19, social work in many countries was not recognized as a critical service. It wasn't recognized as essential service. Many countries considered food, water, and health as essential services. So what does that mean? Does that mean that social work is less important? Does it mean the protection and of the rights of the marginalized people is considered secondary? So because of that alone, it gave the interveners, those who are responding, a situation where they relegate social work practice in a community as a secondary service. So this became a very challenging thing, so that if you want to deliver social work services, then you have to justify why you are delivering it. So that brought in a lot of ethical issues to deal with. The other issue, a practical example that we can look, is how social workers who find themselves in the front line to provide services have been protected, especially when we look at medical social workers who need PPE, the private protection equipment. Many of them do not have the facilities. At least for some, those who are doing clinical service, they have the facilities. How about those who are tracing the families? Those who are doing the prevention, those who are doing the mitigation, those who are reuniting the families? They have to intervene, but they are not protected. And that was not prioritized. So the ethical dilemma there is, do you go ahead and provide service minus PPE? Or do you make people just die because you are not protected? How far can you stake your neck at the expense of the life of the people? Then there was an issue of law enforcement during the lockdown period, overstepping their mandate and jurisdiction. The lockdown came in a militaristic way in most cases, with the curfews, don't do this, stay in your home. So, and the people who are enforcing that were actually the military people. And most of these people do not have actually human rights concerns. So for them, it is when this time has passed and you are against the law, they beat you up. So in Uganda, there are many people who are beaten up, those who are even arrested, those who are tortured, even at the point when they're trying to serve, even taking pregnant women to the hospital. So that gave some kind of dilemma. There was also the issue of the lockdown of services. And one thing that we realized in Uganda, which was very unfortunate, they locked down the pipeline for the children. There's a free call-in line for children who are abused or those who are suffering to call in. And that was one of those that was locked down. So children were denied services. So when a child is harassed, the child cannot access that service to report. That was very unfortunate because they did not investigate and find out, was this essential service? Was it critical? So many children end up suffering in that. Then there was the issue of the limited access to deliver services due to, lockdown and curfews that I've already said. When it's curfew time, you have to be where you have to be. Then one practical example, just to illustrate how the limited access to service delivery became an issue, was a case that we witnessed in Uganda, where a nurse who was supposed to, take a patient to the next referral, she called an ambulance, and it took 7 hours. There was no response for the ambulance service. What did she decide to do? She decided to use this roll, the chair for the patient, to roll this patient 4 kilometers to the next referral center. And when she reached there, she delivered the patient. Unfortunately, the patient died. But it became an issue because people started saying she was actually trying to undermine the task force. Why did she pull the patient? You see? So then she was actually intimidated. She was harassed by all the authorities. Why did you do that? You see, this is a serious example of an ethical, and a human rights issue. What was she supposed to do as a nurse? To let the patient die at her hands, or to try to do everything possible? And when she tried to do that, she was confronted with that dilemma. Another thing is the issue of food assistance to the most vulnerable people, you know, because not everybody can access food. Then food had to be given to those who are really in need. And then there are questions of, is it an entitlement or is it a right? Who gets and who does not get? And where does social work come in to determine the most vulnerable people? We're not there. So this is the narrative that we have to interrogate. Do we have the structures and the systems to be on the front line to be able to decide? So the decision of who should get and who should not get is left to those who are in the task force, and there's no social worker sitting at that table. So how do you get yourself there? How do you determine? And that is even compounded with the fact that there are reports that some of the food that are provided are not very healthy. They are not in good condition, and yet they're being given to the people to eat. There's an ethical issue. Somebody's dying and somebody needs food, and this person is giving food which is not good enough. Should he refuse or should he take? Those are now the issues the social workers find themselves in. Lastly, there are the issue of corruption and dehumanizing recipients, or, you know, people are using advantage. They are taking advantage of this COVID-19 resources to be able to enrich themselves. This is known here. It's not a hidden thing. It's all over to an extent that, you know, the members of parliament abrogated to sell themselves 20 equivalent $20 million US to distribute among themselves as members of parliament. And yet this money is supposed to fight COVID situation. So those are some of the dilemmas that are, you know, to me, brought as a result of the COVID-19. That said, what can we do? What can we learn from these social workers? We need to position ourselves. There is a lesson for us to learn there. The questions that we need to ask is, are we relevant? Are we useful in emergency situations? Can we be the frontliners in order to provide the services such as food? Can we be the frontliners to provide education through social workers? Can we be there to determine who gets the right nutrition and the food and the basic needs for the children? Do we have the structures to deliver this? And do we have research to inform the policy? And how can we influence the policy in favor of the most vulnerable? These are challenges that we are confronted with, but these are things that we should learn from going forward, that after the post-conflict situation, we need to work on and improve and make ourselves relevant if we are to make a change in our profession. Thank you very much for listening.
Thank you very much, Charles, for the insights. Before you go, my question is, you really have to go because of the lockdown, or we can still have you during the discussion?
I will have to go, my friends. Sorry, but I will connect when I reach home. And
You'll have to
catch up. Yeah.
Thank you very much. We do appreciate your presentation. Thank you very much. If we have questions, we will then forward them to you for you to respond later. Thank you very much. Stay safe, my friend. Thank you.
Thank you. Thank you. Stay well.
Going to your web night yesterday.
Sure.
Thank you. Joachim.
Yes, Noel.
Did you follow the presentation, and what was your take from his presentation?
I followed the presentation keenly. I looked at, the issue of provision of services amid the lockdown. I think that is very critical, because I think the focus was only attacking or fighting COVID-19 and not considering that we need to continue providing services that we've been providing to vulnerable groups. So I think that was key. And also, I think the other issue was the human rights issue. And I think it's not only in Uganda where people are being kicked, beaten for being found in wrong places at the wrong time. As a result of the curfew or the lockdown. I think in many places we've learned of how people were being beaten. So I think that was a concern. And I know of some of the social workers that were part of the group that was looking around for people that were, found in drinking places and stuff like that. And I know that they were working under the law whilst obviously being challenged with the ethical dilemma. And I think the other issue that I was looking at is the aspect of those people that have been put under mandatory quarantine. We see that in most countries, when somebody arrives in a particular country or in a particular town, they are put in a mandatory quarantine, kind of a quarantine center, where we've been receiving reports of challenges when it comes to access to food, and also even them getting in touch with their families. I think those are some of the issues that have been of concern, I think, during this period. Noel, maybe there's something else that you can trying to bring
interestingly,
to light.
that social work was seen as an afterthought when services were being looked at. In that, I think at the onset, it was purely looked at from a medical perspective, and social work was taken as secondary to the services. And also, he raised another question, another important issue in terms of the structures and having adequate structures to intervene. But worrying is the issue of corruption and keeping their hands in the cook jar and then misusing the resources donated or otherwise meant for the responses.
Yeah, that is a very big worry, and I think those are some of the issues. We could have a separate webinar probably to start talking about those concerns. So I think for now, Noel, probably we can move back to Kennedy, and before we get to Nigel. Kennedy, I think that we are going to give you just—
Do we have Kennedy?
Yes, we have Kennedy, so we'll just give him about 4 to 5 minutes to just wrap up his thoughts. So Kennedy, 4 to 5 minutes, please. Kennedy, if you can unmute your mic.
Yeah, thanks. You can hear me?
Yes, we can.
So thank you very much. I'll pick it up from where I ended. I was talking about why we really need to be very evident and very visible in this COVID situation, because it poses serious ethical issues and also human rights concerns. In my country, for example, Zambia, as I stated, we first recorded the COVID case on 18th March 2020, and we have seen an increase in these cases. Now, what are some of the measures that the government has taken in the wake of the COVID situation to try and mitigate the situation of the COVID-19? One, we have seen that Ministry of Health has increased surveillance in terms of testing of potential victims, so that at least the situation is managed or controlled. We have also seen the government, which has also tried to do what we call contact tracing. If they have found someone with COVID-19, they will look at where this person has been, who has been in contact with, what has been happening, so they are able to check and rule out any possibility. The government has also developed what we have called the contingency emergency plan to try and respond to the COVID-19, attend to the victims, and also try to address the risks that are associated with this COVID-19 situation. Among the measures that have been put in place is that there is a mandatory call for every citizen, whether when they're in public places or wherever they are, to try and wear the mask so that we can reduce the spread of COVID-19. There is also the call that we need to have sanitizers in public places, and there is also the mandatory quarantine of people that have come. And we have also seen a lot of messaging around the COVID-19. Now, from these measures, I pick some critical ethical dilemmas and also human rights issues. Let me, for example, take the issue of putting up the masks. Whilst it has been mandatory that every citizen should have a mask wherever they have been, we have also seen some situations where some members of the public, and they are seen in public vehicles, for example, or they are seen on the streets, are being chased away, or are being turned away. And I've seen some elements of people, so to speak, being harassed. Now, from the social point of view, I think we have got a responsibility to ensure that every person is treated with the dignity which they deserve. So I'm seeing some ethical issues in the sense that social justice is needed for protection of people and treating people with the dignity and worthiness which they deserve. Let's take, for example, mandatory quarantine of people that have been suspected or they have come from COVID-19 risk areas. We have seen these people taken to these particular places. I think what is very critical, in our opinion, is the need for the service provision. Now, what are the services? We know as social workers have problems. Now, we're having situations where we are quarantining people, and these people do not take care of what is happening to their respective homes and how their family members are being attended to, and they wants to observe the COVID-19. They are also more. So I think we, as social workers, there is a need for us to be on the call. What I've also noted, Chair, is that the COVID-19 response in Zambia is largely medical. Why do I say so? If you look at the quarantine centers, the quarantine centers, for example, there is a need for people with the necessary competences to receive people, talk to people, deal with people. Remember, once someone is told you are a suspect or we are taken for quarantine because we want to check with you on what has happened, everyone is in a sense of shock and despair. So we need the people that are able to restore, this is self-esteem of these people, and also try to prepare them. This is not a death situation or something but this is a social problem that is global, and that we need to need to prepare these people and also address whatever given the limited time that I have. I think for me there are a lot of ethical issues and human rights violations. If people could be asked to leave public places, to go away, I would like to believe that that's a violation of human rights that we need to have serious concerns as the social work profession. Let's look at the messages that have also been prepared. How have these messages, for example, taken into consideration persons with disability? Now, what are we doing as a country and as a social profession? I've been in serious discussions personally by virtue of my position with my permanent secretary and my minister, and agree with me that we really need to reach out to our colleagues in the medical profession so that we, as of social workers in Zambia, to be the frontline service providers in the COVID-19 pandemic, and also the way forward. Not necessarily COVID-19, but also a lot more other things for, I think, the internet, which was failing me, but I would like to end from there for now. Thank you very much.
Thank you very much, Kennedy, for your presentation. Thank you very much for sharing with us. We will now move on to Nigel for his presentation. Nigel, are you with us? Nigel?
I need to unmute there. Can you get me?
Oh, yeah. It's over to you, Nigel.
Okay.
Can you introduce yourself, sir?
Yes, thanks very much. Okay, I'm Nigel Hall. I have a history going back to teaching social work in Zimbabwe over many years, and then coming over to the UK as part of the diaspora, practicing social work here, teaching again. I've also been working with the International Federation of Social Workers as the Human Rights Commissioner for many years. Recently stepped down from that, and I'm working with SWIM in Malawi and a member of BASWA. So that's me briefly. Should I continue?
Yes, please.
Yes, you can.
Okay. Right. Well, there's so many issues we've heard just now, and what I was doing was an overview, really, of the African situation, and so many of those issues are ones that I'll be looking at now. I'll try and go a bit quicker because I know we haven't got that much time. I think Pauline mentioned about how human rights are very much a part of social work, respect for worth and dignity of all people. And it's certainly the case that social work is definitely the human rights profession, and the human rights are integral to the profession. Thinking of the African situation and COVID, I was looking at the statistics from the African Center for Disease Control based in Addis, and today there were 49,352 cases, 1,959 deaths, 16,315 recoveries, which sounds a lot, but it's not that much when you think in the UK, we're already at about 30,000. That's just for one country. Anyway, let's hope it doesn't get worse in Africa, but it's still obviously very, very serious. Thinking back to the previous webinar and the contributions that people told us about, and also we've been hearing today, and these are human rights contributions, psychosocial support to those living under lockdown, helping in situations of domestic violence, social protection initiatives, in identifying poor households for assistance, implementing cash transfer schemes, distributing food, providing correct information on COVID, and dispelling some of the myths that surround the virus, trying to counter stigma, reintegrating children with families, taking them off the street, and developing peer counseling, other group support schemes. So there's so much that social workers do. And I think we are very integral, really, even if there are concerns that social work is not being taken seriously and not being recognized. Now, there were 4 key areas I wanted to cover related to COVID in Africa and social work. The first was access to food and shelter and physical security. And these are key to human rights. We were hearing from Anton last time about Maslow's hierarchy of needs, where the physical needs need to be satisfied first. And so in a health emergency, these physical needs need to be dealt with. They're fundamental. The needs for food, also nutrition, clean water, secure accommodation, and safety. But we can't assume that we know what those needs are. Social workers have to listen to what people say, and we know the importance of listening to people. We work with them all the time. We need to speak to the women, the men, youth, the elderly, what they want, what they can do for themselves, what they would appreciate. We've been hearing about serious problems of drought, floods, swarms of locusts in East Africa, and so on. People tend to have, there are many, many serious problems, and people tend to look after themselves through their relatives, the community. They have limited resources. Now, in a lockdown situation, which is what is happening at the moment, things can quickly get out of hand and people pushed into destitution. So if we're going to have lockdown, it's important that the social and the economic impacts are taken into account, because these will quickly spiral into a serious situation for people. And we have to query whether their lockdown is appropriate for Africa, which has a very young population anyway compared to Europe. If you think the median age in Italy and the UK is about 45 and 40 respectively. In sub-Saharan Africa, it's about 20. And we know the younger people are less affected, although they are still affected. But nevertheless, the lockdown has been chosen as a strategy, but longer term it may not be workable at all, because people are so reliant on earning cash, on surviving a day at a time, and often living in very high density suburbs, or even slums, where it's almost impossible to stay the day in a house. So this is an ethical issue, I think, which is really important, and the social workers need to help people in living in these trying situations and doing what they can and supporting the communities. The second issue I wanted to look at was community-based responses being vital. Now, African countries have learned a lot from tackling epidemics in the past. We've got HIV and Ebola. Some 15 million Africans died from AIDS before cheap antiretrovirals were available. Ebola killed about 11,300 from 2013 to about 2016. And social workers were involved in helping communities deal with those situations. And quite often it was from listening to people that quite simple solutions developed. For example, there's the Veronica bucket. It's a very simple, effective receptacle where wastewater can be collected after people can wash their hands from a tap in the bucket. It was invented by a Ghanaian health worker during the Ebola outbreak. Senegal as well is developing a $1 COVID-19 test kit that they're rolling out. So there are solutions which these African countries can develop for themselves as well. But the communities need to be involved, respected and empowered. And not just, the assumption shouldn't be made that people should always be given things or handed down to them. Now, a third point I wanted to look at was the need for international solidarity. Now, there's an ethical requirement for social protection, which is very strong within IFSW, and IFSW spearheaded that through developing its own social protection policy. And we all know how important, we've heard about the importance of social protection in this epidemic and how social workers are helping people with these cash transfers and so on. But unfortunately, global protectionism instead of global solidarity has prevailed, with more than 70 countries imposing restrictions on the export of medical materials. And even where the African countries can afford to import, often the chemical reagents for the testing is not available because they're all looking after themselves. Now, although many Western countries may have put huge sums into supporting businesses and social welfare schemes in their own countries, many African countries don't have that option. So it's a time really where solidarity, international solidarity is really important. And there's a moral duty really to assist other countries. And there's also clear self-interest here as well, because borders are not something a virus respects. National border controls don't work. The pandemic is operating everywhere. So it's important that we all work together in this situation. And international solidarity is important through the UN and the national associations we have and the regional associations that are working together as we are at the moment. And fourthly, my final point here is that African countries themselves now must respect human rights. And we've been hearing from some situations about problems that have developed with the virus. But before I look at that, the World Health Organization has urged African Union members to fulfill a pledge made in 2001 to allocate 15% of their own annual budgets towards the health sector. And 10 years later, in 2011, the UN agency noted that almost all countries had failed to meet that target, and it's pretty much the same today. Now, I know obviously countries have quite serious problems, and we can understand maybe why they haven't, but it's something that needs to be given more attention. Human Rights Watch has reported about the severe restrictions on many people's rights in lockdown, particularly with beating, and we've heard some of this, forcible removal of informal traders from the street, in some cases even the shooting of civilians. It's occurred in many countries: Kenya, Nigeria, Uganda, South Africa, South Sudan, Zimbabwe. I suppose we can understand it to some extent because it's such a serious situation, and these countries are trying to impose a state of law and order. Often it's the police, as we've heard, or the army that are not really familiar with human rights concerns. But nevertheless, that needs to be respected. And I should say as well, of course, the countries themselves are providing a lot of assistance. Nigeria is using National Social Register to map and identify vulnerable groups for financial help. Rwanda has a safety net, including food distribution. South Africa has a Solidarity Respond Fund. Kenya has tax relief and reduction of salaries of senior state officers. So there are many things that these countries are doing, and we need to support and help them to do that. So overall, in concluding, I think I would say that social workers are providing much needed community support to vulnerable members of the community in backing up many of the initiatives I've just mentioned. Social workers are at the forefront implementing some of these initiatives our countries are trying to introduce. And our social work associations are supporting social workers at the front line in a very positive way. And IFSW and the Africa region are supporting these links through communications such as we have today. I think that's all very positive. So I want to just congratulate everybody for all the work they're doing and for everything they've been telling us about today. Okay, thanks very much.
Thank you very much, Nigel. Any last words?
I'm back.
Nigel?
Sorry, last word for me.
Sorry, Olu will come back to you. Nigel, back. Any last words?
Yes, I had issues with my connection.
Sorry, Olu. Thank you, Olu. Can I come back to you?
Do you want my last words?
Yes.
Okay, maybe 3 key points. Social work is fundamentally a human rights profession. It's everything we do all the time, and so this is intrinsic to what we do. Working with the communities, people we work with. Secondly, communities are key to tackling COVID and need to be engaged and not seen as something that is an obstacle. So we need to use our anti-discriminatory, anti-oppressive values in supporting people through respect and dignity. And thirdly, this idea of international solidarity. We need to work more with that and develop that solidarity between our different countries and regions. And in terms of sharing resources and empowering social workers around the world and engaging the governmental and non-governmental organizations that we can use to support the work we do. Okay, thanks very much.
Thank you, Nigel. Olu, welcome back.
So I just came back. I've missed the discussion.
Oh, just your last words in 2 minutes.
2 minutes, okay.
Yes.
I just want us to remember our colleagues who are working in some homes, orphanages, juvenile, adult correctional institutions, rehabilitation centers, and hospitals. Others are mobilizing action for social development and the provision of essential commodity for citizens in need. At this COVID-19 pandemic situation, these categories of social workers will be faced with ethical dilemmas, which they must be conscious about. We need to assist them. We're expected to make use of the social media where there is no physical interaction. As our colleagues, we need to get to them and encourage them to continue to do more. Thank you very much.
Thank you, Oli. How can we improve or increase visibility of social workers? Quickly.
Yes, like what some of us have been doing. Most people are unable to go out because of the lockdown. We have so many platforms like WhatsApp group, like a Facebook page, and also other platforms that we are connecting. We have groups that we are discussing the issue at hand, and we are reaching out to the grassroots. We are reaching out to the grassroots. So social media is the most important thing that should be used at this period. We should use it to connect to the communities, to our colleagues, and also our clients. Thank you.
Thank you very much, Olu. Joachim.
Okay, so yeah, so we go to Pauline. Pauline, just under 1 minute. In fact, for me, I think I'm quite strict with time. Under 1 minute, your last reflections.
Time given, I would say that social workers' primary responsibility is to promote the well-being of clients. That is now on different levels. And one of the issues that I forgot to mention was the closure of schools in Namibia, which has affected children. They are now staying at home. So I think I now hope that next time we have a discussion, we can talk about how children's education has been affected due to the lockdown, because there are various issues that are critical where we can advocate for the rights of children to education. And thereby I've also identified dilemmas that we are facing there. So thank you very much for the opportunity. Thank you very much to all the viewers out there.
Thank you, Pauline. Before I let you go, how can then we safeguard the rights of women and children amidst domestic violence? Quickly, can you address that quickly?
It is quite a challenge to safeguard children and women's rights to to protection because of the lockdown regulations. However, in Namibia, we have GBV hotlines, as well as a hotline for children where they can report cases of abuse. And that is the 116 number, as well as the 106 number, which is being hosted by Lifeline Childline in Namibia. So in short, I would say that if there's any community member out there who's facing a situation of abuse or so, they can contact those numbers as a matter of urgency. There's always somebody at the end of the line to listen to their concern. And for now, under the lockdown regulations, I think that is the best way that one can do. However, social workers are also available countrywide. It's up to constituency level. Their offices are open where clients can consult social workers if faced with such a situation.
Thank you very much, Pauline. We will move on now to Kennedy. 2 minutes, Kennedy. Kennedy, are you still with us? I think we have lost Kennedy. Dahlia, are you with us?
Okay.
Joachim, oh, she's with us. Dahlia, two minutes. Hello.
I'm around.
Can we start with Dahlia, then I'll come back to you, Kennedy. Sorry, let's start with the lady.
Okay. We must train social workers all over the world on how helps others to face the coronavirus, starting with the family levels and the work levels and the friends and all the social workers can dealing with in societies and in the world. You can learn social workers how you use the ethics and the methods and the experience and the skills of social workers, social work to provide and to helping other to face the corona virus.
Thank you very much, Delia, for your thoughts. Kennedy?
Thanks.
Thank you very much. Indeed, social work and social work profession means a lot and means so much to the people. And in this trying moment, I think this is where ourselves are very, very critical. We need to use our skills, our knowledge base, and we are rich with a decision-making model. And you see, with this, we really need to point out these ethical issues in our society and continue promoting and advancing human rights issues. I think in my opinion, we also need to look at the social work fraternity. We really need to increase the sensitization and awareness raising in society, because I think we are closer to the people. We need to advance the social work justice and promote integrity and human relations in our society. Thank you very much.
How to include persons with disabilities quickly, Kennedy?
Come again?
How do we include persons with disabilities in all this discourse? The inclusion of persons with disabilities.
Them without them. Yes, that's as the adage goes, that nothing for them without them. In whatever we are doing, in whatever is happening, we really need to ensure that persons with disabilities are involved and are included. When we talk about sensitization, awareness raising, I think let's involve persons with disabilities. Let's be sensitive to the needs. And for example, when we talk about communication and messaging, let's ensure that the messages and communication materials include all persons with disability. For example, we are talking about sanitizers. We are talking about, we have seen there are wash basins that are in public places. How are these within the reach of persons with disability? So I think as social workers, we really need to advance these ethical values and the need that persons with disability see themselves not only to be part of society, but
Thank you very much, Kennedy, for your thoughts. And thank you to all the panelists for their thoughts. Like always, time is not always on our side. I will invite Joachim for an overview and his discussion over the issues that were being raised by the panel. Joachim, what's your take as we try to conclude today's discussion?
Thank you. Thank you, Noah. I think we've learned a lot, I think, from the different speakers. I felt as if I was in Nigeria. I felt as if I was in Egypt. I felt as if I was in Namibia. So the learning, I think, was quite immense and very enriching. And I think going forward, we will continue with the conversations and we'll continue, learning from one another. I think one key thing that I've learned today is also the aspect of practice. We're talking about social work practice. How relevant are social workers, I think, in this discourse? How are we going to make ourselves relevant other than people just seeing the relevance from the sidelines? So we need as social workers to bring ourselves on the table and offer solutions to what is going on. So I think, Noel, we as social workers, we need to ensure that we engage governments, we engage decision makers, so that they don't just invite us, but we need to move, to go to them and put across what it is that we can provide, what it is that we can contribute to the discourse.
Charles raised a question for us as social workers. We relevant. So in our relevance and in what we do, we need to be relevant in responding to the problems that are affecting the people that we work with. And in this case, the issue of COVID-19 and how it is affecting people, it is the time for us to rise and also challenge the injustices that then also emanate from the responses that are coming up.
Exactly, Noel, and I think this the COVID has acted as a big reminder for us as social workers to rethink the way we do things. And I think beyond COVID-19, I think we need to cease from doing things as business as usual. I think we need to do things differently so that people can see that yes, there is value in social work.
What are some of the topics that are coming up in our discussions in future, Joachim? Not in necessarily any order.
Yeah, not in any order. Yeah, we've been considering having a webinar around issues to do with indigenous knowledge or indigenous interventions. And I think Africa is rich in terms of what they can share about the certain things that we do in an African setting, which enrich social work practice. So we'll, after that, we'll be having another conversation, I think, which will be basically involve, some politicians, some high-profile people that are key to promoting the profession. And so quite a number of topics that we've lined up that will be engaging and also trying to share amongst ourselves.
One of the issues that Pauline brings out about children and vulnerable groups and women and persons with disabilities is also within our radar. Is that so, Joachim?
Exactly, Noel. So we will be discussing issues to do with women and also how the COVID-19 has impacted negatively on children and women. We are hearing so much about domestic violence, the fact that people have been told to stay home. So stay home, and you're staying home with the people that are around you. But at the end of the day, we start seeing issues of domestic violence. So there will be a conversation around, issues to do with domestic violence, issues to do with child abuse in the midst of the lockdown.
We are also working towards having the webinar in French and also in Portuguese. That is something that we should be expecting very soon. Can you comment on that?
Yes, I mean, Africa is not just an Anglophone. We have the Francophone. We also have the Portuguese speaking members of IFSW. So we're trying to see how we can expand the platform so that we bring, different views, we bring different voices from different countries. So yes, we've lined up some webinar around, which is going to, are going to involve, the Portuguese speaking countries, the French speaking countries, so that the conversation can, grow. I mean, there is something that we can learn from Mozambique, for instance. There is a lot that we can learn from the DRC. So yes, we are trying to see how we can be as inclusive as possible.
As we end, we also want to remind social workers to stay safe and also to follow IFSW Global. There's a webinar next week. And for social workers to follow, visit the website, you get more information. We also have Kathy, who has been appointed to run with COVID-19 as the focal person, and who is also giving us more information about COVID-19. Do you have any other comments or announcements, Joachim?
Yeah, I mean, so for our viewers, you can follow the IFSW Global Facebook page and also the IFSW website. There are a number of announcements there, including the study around ethical issues that we may need to contribute as social workers. So let us follow and rally behind our profession. It is only us that are going to make social work great. Let us make social work great again.
It is also very important for members in Africa and elsewhere also to contribute so that the African voice is also heard in these we also want to appreciate IFSW Global, Children Families International, for having allowed us to have this platform. We are grateful for that. We are also grateful to Lola, who is in the background, and Anton's doing the technical work. We are very grateful for that. Also, to say to social workers, as you remain great, as you make social work great, as you make communities great, please keep safe, follow the guidelines, the WHO guidelines, and in-country activities and guidelines. Keep safe. Joachim?
So thank you so much, everyone. Thank you so much, speakers. As Noah has said, we appreciate you. We appreciate your contributions, and we hope to have you again and keep following the series of our webinar. So we'll be having the next, I think, in the next 2 weeks. So thank you, and thank you so much.
Thank you. Bye.